Originally signed into law in California in 2021 and implemented the following year, Ryan's Law marked a pivotal shift in end-of-life care, granting terminally ill patients the legal right to use medical cannabis within healthcare facilities. Now the legislation is emerging as a model for similar policy efforts in other states across the country. The law is named after Ryan Bartel, a U.S. Coast Guard veteran who spent the final weeks of his life battling stage 4 pancreatic cancer. His father, Jim Bartel, witnessed firsthand the difference medical cannabis made in his son's final days, and has since become the driving force behind the legislation that bears Ryan's name.
2018, my son was on a ski trip with 3 of his friends. He called me the next morning and said, "Dad, I have some terrible news. I've been diagnosed with stage 4 pancreatic cancer, and they're giving me weeks to live." Excuse me. He was asleep because the doctors said that he'd been on morphine for the pain, but it wasn't strong enough, so they added fentanyl, 100 times more powerful than morphine. But all I did was put him to sleep. He said, "Dad, you need to get me off the fentanyl and the morphine because I don't want to spend my last few weeks sleeping." So I talked to the oncologist. We gave it to him that night. He woke up the next morning wide awake. For 2.5 weeks, he was awake every day. Committee, my name is Jim Bartel. I'm the father.
In 2025, lawmakers in Rhode Island and Oregon introduced legislation that mirrors California's Ryan's Law, signaling growing bipartisan momentum around the idea that terminally ill patients should have the legal right access to medical cannabis during end-of-life care.
Did any other state have movement?
Yeah, so 5 or 6 that are actually either drafting the bill or in the process of drafting the bill and having it reviewed by their legislative councils. And we have another 6 or 8 states that are in the process of reviewing and drafting their own legislation based on Ryan's Law. So I did 3 months of research, found an author, Senator Ben Hueso, San Diego. February of last year, we introduced a bill called Ryan's Law. The bill, in essence, said that all hospitals in California are required to allow terminally ill patients to use cannabis for treatment and or pain relief.
During the process, Jim was just a champion. He spent that time in Sacramento, and he worked with the Assembly Health Committee. We actually brokered a deal to make sure there was a safe harbor provision. So there's a mandatory provision that allows for patients who are in hospice care to have safe access to cannabis. But this provided a safe harbor, so if the hospital was threatened with losing their funding from like a Medicare or Medi-Cal source or Medicaid, then it would allow them to suspend that program. So we completely resolved that issue.
With momentum building in state legislatures across the country, the conversation around medical cannabis and end-of-life care is increasingly focused on practical implementation rather than ideological debate.